What is the utility of measuring cortisol levels in psychiatry for mental health? Let's dive in. So, one of the labs that we order here at Driftless Integrative Psychiatry is a salivary cortisol test, which is done collecting a spit sample basically 4 times throughout the day. Right away when someone wakes up in the morning, later in the morning, early afternoon, and then at bedtime. And basically, cortisol is our body's main stress hormone. So when there is some sort of threat going on, our body, and particularly our adrenal glands, which sit above our kidneys, their job is to make cortisol, which basically activates our body and prepares for this threat as a way to protect us. So it's a really important response. It's important for our survival. But what can happen is our bodies can potentially perceive things as threats that may not actually be threats, or may kind of be stuck in this fight or flight mode where our adrenal gland is constantly producing too much cortisol. And what happens is that when our body is releasing too much cortisol, it has a lot of downstream effects and can impact our sex hormones. So we think of things like progesterone, testosterone, and estradiol. It can affect our thyroid function, our sleep, our metabolic health. So things like weight gain, blood sugars can be impacted when we release too much cortisol. So this lab and checking someone's cortisol might be helpful if someone is having particularly feeling like they're feeling wired and tired, they are not sleeping well at night, they are feeling hypervigilant and anxious and wired during the day, they are waking up in the middle of the night in particular. So those would be all situations where getting a cortisol lab would be helpful. And basically, what it does is it gives us objective data and lets us know what's going on with cortisol levels in your body. And that way, we can create a targeted treatment plan that involves regulating and modulating cortisol levels. Sometimes what can happen is if the body continues to produce too much cortisol, we get to a point when the feedback loop gets disrupted and our adrenal glands actually start making too little cortisol. And that can have a negative impact on our physical and mental health as well. So basically, the cortisol labs give us some objective data. Typically, treatment for too much cortisol is going to involve lifestyle changes. So basically, prescriptive restoration is what I call it, and helping your body rest. Another component is typically some sort of adaptogen or supplement, depending on your symptoms, that can help with regulating cortisol levels. There are lots of other modalities that can help decrease cortisol that we can talk about as well. So again, we use this lab as objective data. Cortisol is helpful, but we can get to a point when our bodies are just making too much, and that can contribute to metabolic symptoms, mental health symptoms, and hormonal issues as well. So that's a little bit more about cortisol and mental health.